So before lockdown, we dealt with 55 plus with general needs, and 18 plus with complex needs. During lockdown, we've really had to change the service to basically anybody that comes into the service, which means we deal with larger groups of people, different groups of people, and different people from different cultures as well. Before lockdown, we offered a 12-week intensive support, where our job isn't to solve the issue, but our job is to link people into services that will work with them on a longer term basis, with an outcome of making them independent again. And during lockdown, we really kind of didn't do our day-to-day job and had to adapt to delivering food parcels and prescriptions and anything and everything really. So going from doing 4,000 people to 18,500 people's prescription runs and food deliveries.
As a result of the COVID lockdown, we had to change a lot of what we did in Aegis Thanet. As a programme that was about reducing social isolation and loneliness by enabling people to get together and to take on activities and try new things, not being able to meet face-to-face had a really big impact. We tried to move as much as possible online and the telephone. So we set up a weekly telephone befriending service. For those people who had already engaged in our project, having someone that they knew and had an existing relationship with and trusted was really important in a time when everyone was so worried and nervous and concerned about what was happening. We've also, what's really great is that some of the people who received calls initially are now volunteer telephone befrienders, so have kind of engaged with the programme in a different way.
People are generally a bit more anxious about going out. They're having the telephone calls with their ESAs. ESA stands for Employment Support Advisor, by the way. There's 3 projects that deal with employability that Social Enterprise Kent run. One of them is Let's Get Working, dealing with people who have disabilities or long-term health conditions. There's another one based in Folkestone called Working Together, and my project deals with the people aged over 45.
As a training provider, Social Enterprise Kent continued to deliver face-to-face health and social care training for local care companies. It was deemed an essential service, obviously, at the beginning of lockdown, and meant that we could help local companies meet the demand for new carers that there was. We also supplemented this with e-learning courses, and we devised some new courses, sort of getting your workplace COVID ready, understanding about infection control, which were really vital for supporting our voluntary and community sector organisations back into the workplace.
There's definitely a lot more online training available out there nowadays, and so our participants on all the projects wouldn't generally know about what's out there, but thanks to other services like ConnectWell, providing those directories with all the other services that are out there and still available for our participants, just sharing everything. The online training has been really helpful for us and our teams to get the participants back into work.
Yeah, one that sticks in my mind is a lady in Dover, in her 70s, possibly 80s. She was on her own. Her family lived away, and she had no support locally. She was really worried about how she was going to survive the pandemic. She was on a lot of medication, and she had no access to that medication. So we got a referral from a local community group about her, and the triage team contacted her, and her reaction was we saved her life. So we managed to get her prescriptions to her on a regular basis, and we also managed to get her regular food parcels delivered to her during the lockdown. And now, out of lockdown, I say out of lockdown, but moving forward, she's now in the community navigation service, and we're now supporting her to reduce her social isolation and increase her social well-being.
We had a lady come through to us during lockdown via Aegis Thanet. Just arrived in the country, didn't have any friends, had lots of skills from working in the care industry. She got in touch with Aegis Thanet. They passed her on to us, lots more to offer. And one of my ESAs worked intensely with her. He met her in a car park, signed her up with a 2 metre safe distance and asked her to provide all the relevant information that she would need to. She applied to lots of jobs with his help. They did lots of telephone work together and online search. He did lots of job searches. He actually successfully got a job. It all happened during lockdown, so that's one of our favourite case studies.